49 physicians in 18 locations in Albuquerque and Rio Rancho, ABQ Health Partners is a physician-led multi-specialty medical group leading efforts to bring total care and patient-centered care to our community.
And this week we headed out to get more information on how ABQ Health Partners can help you and your whole family no matter their age. Take a look.
Hey guys, we are here at ABQ Health Partners today, home of Total Care, and we're finding more information out about how they are keeping New Mexico healthy. Come on. Hey guys, I'm here with Dr. Mark Hardwick, who is a medical director here with ABQ Health Partners. And doctor, obviously technology, the way that medicine is administered to patients has really changed a lot over the years, and it changes very rapidly as technology is increasing. What are some of the biggest changes that you have seen in the healthcare industry, and particularly with ABQ Health Partners?
Well, ABQ Health Partners is part of the healthcare industry, and our changes reflect everybody else's. Increasing access to care through the Affordable Care Act is bringing people in who have not been able to get care in many years, and it's been off to a slow start in New Mexico, but it's coming, and more people are able to access the system, which is a good thing. Our records and our communications are more and more electronic, so people are able to share information more readily than in the past, and that has facilitated more coordination of care, which is important. And perhaps most importantly, how we get paid changed. In the past, we got paid for seeing sick people and doing tests and hospitalizing folks, and we got paid for that. Now, the way payment models are starting to change, and ABQ is changing its culture to take advantage of that, is that we are beginning to be paid for keeping people well, for doing preventive care and keeping close track of them so that they don't get sick enough that they need to go into the hospital, and not duplicating tests. And that's good for patients. It's kind of mirrors what we all went to medical school for, to keep people healthy. And now the system is changing in ways that allow us to actually practice that way, and that's a very good thing.
Medicare's open enrollment started October 15th.
Yes,
We've got a window of time for people to make adjustments, changes to their programs.
Yep.
What are some of the big things that you think consumers and patients need to know about this open enrollment period?
Okay, well, the open enrollment period for Medicare patients extends until December 7th. And I think it's an opportunity for everybody in a Medicare program to look at their coverage and examine what sort of coverage they need. There are different kinds of plans. People who are healthy might need just a supplement for things that Medicare doesn't cover. Some people who are sicker or anticipating health problems might benefit from a more comprehensive program that allows for some of the coordinated care programs that we're able to provide, and really allows us to take their care in hand in a much more comprehensive way than has been done in the past.
So let's talk about Total Care. This is a program that you guys are administering, and I think it's a really great, I mean, obviously by the name, Total Care is a very comprehensive way of taking care of your patients. So what is the program all about?
Well, Total Care is a way of bringing coordination and communication to patient care. There are a lot of people who take care of people's health. Physical therapists and nurses and acupuncturists and hospital doctors and primary care doctors and all sorts of people. And in the past, everybody's sort of done their own thing and passed paper around. We're trying at ABQ Health Partners to bring as much of that together as possible so that we have a more comprehensive view of what's going on, so that things don't fall through the cracks and things don't get duplicated. And we're building our system to allow that. And
just last question very quickly, you can't stress enough the importance of having a primary care physician. What is the one basic benefit? If you have to say, narrow it down into one reason why you have to have a primary care, what would you say that is?
Primary care doctor is your doctor. That's the one who knows you, who is thoroughly familiar with their history, who looks at you as a whole person, who makes sure that you get the preventative care services you need, who coordinates with specialists and takes over when the specialists are done. The primary care doctor is the one who is primarily responsible for helping you with your health.
So for more information on ABQ Health Partners, head over to CASA.com and click on the Style tab.